Alrighty. How do I add stew quart? How are you guys doing? We are going to do a talk with Court Cash Wellness today, and we're going to go over peptides. We're going to go over all the good stuff. And look who it is.
Hello, how are you?
Already on thriving. Just got off a little meeting, so it took a little while for me to hop on.
No worries.
Sweet. Hey, do we know, does this automatically record or do I have to like push a button?
Goodness. That's a great question. I think it'll automatically
I think it
record.
saves it to
I hope.
archive. It'll save it to archive. If I'm
Okay.
right. All right, we have one comment that's
I
already
trust
well,
you.
nice. We're
I
starting
think
strong.
I think you know I think you might know better than me, but fingers
I don't
crossed.
want to trust me on things. Well, okay. So first off, I want to talk about just like me and you. But okay. Also, I'm not in a restore page, so I can say whatever the fuck I want. Hell yeah. I gotta be all nice and fucking whatever the hell. Um, we're taking a lot of drugs, and we're young, and it's fun, and we feel great. That's cool. So tell everyone what you're taking.
So first I'll give my little spiel about like the average lab values versus optimization, right? Because that's super important and kind of nuanced when you're talking about, the peptides that we do and everything. And I know that you're aware of this, but even when you take hormones and, you're young or you take peptides and you're young, you're talking about, maybe my lab values of everything are average, but you can optimize everything and then you feel even better. And so that's what I'm doing with my supplement stack and my peptide stack. I take a lot of growth hormone peptides, Zamorelin. I take Macimorelin, which is a little bit newer, methylene blue. I take, I've been on and off, the CJC, Ipamorelin, and then between the Zamorelin, so all the growth hormone stuff. And then, I take low dose naltrexone for inflammation. I do my nicotine patch protocol. Pretty much any peptide that you can imagine that's pretty mainstream, I've either taken it or am currently taking it. Your stack might be a little bit more impressive than mine, but
Well,
um,
I do a lot of drugs too. I mean, you're
yeah.
so we have different goals. Like, of course, I'm training to be, I want 1,000 pound deadlift. I'm trying to be very competitive in a sport where there are guys who are like 300 pounds lean.
Hmm.
It's crazy. So, of course, that's going to require a lot more out of somebody. And of course, there might be a little more of like a health give. There really doesn't have to be. Like, you can still do a lot of fairly healthy with correct dosing. But, yeah, and like I said, all that stuff you take's great, and we definitely connect on the peptide side of things. Because I was talking to another strong man competitor yesterday, and he was going on and on about like, dude, these guys who take all this gear, like all the tren and all the shit, they don't take peptides with it, and the peptides
Right.
can give you a big increase in
Hmm.
everything, cognitive performance, strength performance, everything, and doesn't have like a big ask. There's not like this, like, oh, I'm gonna explode my arteries because
Right.
my blood pressure's through the roof or whatever. So that's where I like to do it. But everything that I'm taking for the exact list, TRT actually prescribed by a clinic. Believe it or not, everyone's like, "Can we take all this gear?" And I'm like, I get some of it from a doctor. That's at 250 milligrams a week as of last week because coach said I can do more. So thanks, coach. Um, and also the fun thing about that, which most people don't know, my TRT clinic and my actual coach talk to each other. Like they know each other. And they work
That's
with all
great.
of their clients together. And I'm like, this is great. Like, you know, they can talk to them and be like, hey, we need to work on the lab values. And, you have actual clinical professionals pairing up with, pro bodybuilders. So
Right.
everyone who's like, how's your bodybuilder know what he's talking about? I'm like, he works with doctors all day. It's like what he nerds out about.
Yeah.
Tier T, I do primobolan with that strictly due to my estrogen being whack as hell. I, you know, primobolan adds anabolic load, so you can get a lot more muscle mass. A lot of women take it because it's not very androgenic on the like, your voice doesn't get deeper. You don't grow facial hair. Like it's
Hmm.
not causing a lot of that, but it crushes your E2. And for some reason, I'm a bitch. I take testosterone and I have crazy estrogen with it. So I need that. GH, same reason you take Morlin and everything else like that. I think growth hormone is like the sweet nectar of life. Of course, overdoing it is not the sweet nectar of life, but
Right.
like lower dosing, oh my God, I think everyone should do it. You're gonna look young forever. Um,
Yeah.
and then I'll do oxandrolone, which is also known as Anavar, but oxandrolone was originally prescribed to burn victims and people with sarcopenia or like muscle wasting diseases. Um, and I do that about every other day now. Uh, a lot of people do orals. Typically, orals either a not effective because they get broken down by your liver, your kidney, everything else is just passing through a lot, or they're super toxic.
Hmm.
I personally choose Anabar because it's the least toxic. It's also the most clinically studied, and I think you can still get it prescribed if you're like really, really lucky. Um, but there, and then all the peptides I take, some max, oxytocin, NAD. Um, I do my high dose vitamin C drip. I did one today. Fucking love it. Uh,
Yeah, I saw.
so good. I wish people understood how great you feel with high dose vitamin C, and your skin's
Yeah.
better. My
Hmm.
skin's not great. I need it, but it's almost
How
like an
many
immediate effect.
grams do you do?
As many as they'll let me get. I'm up to 30 grams now because you have to do like your increments. You can't just like go straight to 50. So I'm
Yeah.
up to 30 now. Next one I'll do 40, and then I'll do 50. And I'll just keep working it up.
Nice. Does it
And
make you
then
really thirsty when you do it?
no, not at all.
It makes me like, especially at like 30, it makes me uncontrollably thirsty.
Really?
Like while I'm doing the drip, yeah, it's like, because I think it's a hyperosmotic solution, and so it changes
Mm,
like the fluid balance in your cells. And I like, I will be sitting there getting a liter of fluid with my 30 grams of C, but like I'm chugging water, and then as soon as the drip finishes, I'm fine. It's crazy.
interesting. Well,
Yeah.
don't you guys have to reconstitute that with, is it sterile water? Is that what
When
you used to?
when you get up to the higher doses, yeah, like the 50 grams and
Yeah.
everything.
Because you guys aren't using backwater. It's a whole different solution with
Hmm.
reconstituting the C versus your. Because I know that the nurse always spikes it with that like giant fucking syringe, and they have to push
Yeah.
really hard. And I'm like this is so
Yeah.
hard. I keep asking because I want to push it. It sounds like fun.
Yeah.
Um, but yeah,
It is.
I noticed a huge energy increase, which I asked one of our lead nurses. I was like, "Why do I get so energetic off fucking vitamin C?" And she was saying it was something to do with the reduced inflammation or something inside the cells. I don't know the science behind that, but she's like, "That's most likely why you feel good after a vitamin C drip."
Yeah, it's great for inflammation. I mean, it's good for your immune system. It's good for collagen production. It's good. Vitamin C is great for the absorption of other vitamins. So, I mean, really, it's like a very multifaceted thing that everyone should be getting at least once a month or, quarterly. Um, I think you and I are on the extreme end of doing drips and shots and all of that. But if you can get it once in a while, I mean, high dose C is great. It clears out all those dead zombie cells and mitigates all the inflammation. And then I saw somebody comment, what about L-carnitine?
Yep.
And I know you love L-carnitine. I also love L-carnitine. I do a lipo shot once or twice a week, which is the MIC, methionine, inositol, and choline. And then I do L-carnitine in that. It helps, with that extra. I do semaglutide on and off, but it helps with, extra fat burning and your metabolism. Um, what do you think about L-carnitine?
I mean, I love it. It's one of the few things where so Alex Kegel did a study with himself, basically. He trains like Olympic athletes. He is killer when it comes to knowledge for these like peptides and PDs and everything. He did 10 grams a day, crazy amount every single day. I don't know how you pen that much because that is so much fluid.
Hmm.
But he was reporting that he felt amazing. All his blood work was perfect. He does crazy blood work all the time. And there's kind of no upper threshold. It's really just how much you can take. I think the typical
Hmm.
dosing regimen is around 55 milligrams per 200 pounds of body weight, 300 pounds of body weight, something like that.
Hmm.
For men and women, just to perform at their best. Fat oxidation, amazing for that. If you're going to cut and you want to retain muscle mass, it's really good. The most important thing, it's natural. Like you're not going to pop a drug test. You're not going to have a lot of negative side effects. Like the
Right.
worst thing's going to happen, tip. You might have like post-injection site pain, or you
Yeah.
might have some flushing from just the needle going in you or something like that.
Right.
But
Yeah, that shot is one of the ones that burns a little bit more intramuscularly. So I feel like if you're prepared for that, then there's no, you know, reason not to get it. I think sometimes if it's their first shot, people are a little shocked at how much it burns. And so generally I recommend something, like a B12 shot or for someone's first time, and then the L-carnitine maybe for next time. But I love that at Restore we can do it IV too. Um,
yeah,
Whenever I get a drip, definitely L-carnitine is in there, all the methylated, B12, B complex, B6, zinc, mag. I often do like 1200 milligrams of glutathione and then my high dose C at the end. So it's a
yeah.
pretty hefty drip.
Well, that's the nice thing about drips is that your body just gets tired of sticking yourself after a while, and your vein can
Hmm.
take a lot.
Yes.
So you pop that little
Yeah.
AC fan right there, and you just funnel everything in, and you're going. I saw a
Yeah.
comment that was like, "Hey, is your clinic for men too?" TRT wise, I work with Game Day and Restore. Restore is for men and women. We don't do any hormones. Game Day is for men, but we do peptides for women. So just note that. But if you want women hormones, don't you work with somebody, right?
Yeah, so I work with a provider network that's all online and telehealth based. It's called No Limits. And we do all, there are different types of peptides that you can get. So there's research grade that are not FDA regulated and not prescribed. And then the place that I work with, we are all prescription based, all FDA regulated. So it's great. It's pretty low cost. We follow up with everything with lab work. So it is evidence based as well. So we're not just doing like a one size fits all. We're actually tracking your hormones, tracking all of your metrics so that when we do give you peptides, you know that what we're doing is working. And the providers are all specifically trained for, HRT, gut health, and everything like that.
Yeah, and I always try to like if I can, I would get everything from a pharmacy. But I mean, there's kind of like a hard barrier to entry sometimes. Either there's a big price difference of like getting things prescribed, or there's like a quality assurance issue of like, okay, I can go to a research chemical site, get something for 50 to 100 bucks, pretty cheap, but I don't know what's in it. I never prefer it, but and also I didn't know you existed. There's a lot of pharmacies that do not a lot of good marketing. I have no idea they're around.
Mhm.
We're not aware of the process, or it's like a super clunky onboarding thing where you're like, okay, I'm just gonna go buy it off fucking amino asylum. Like I don't want to deal with this
Right.
over and over.
Yeah.
So
Yeah.
that's
And
what I
I
was.
think I think too with the research grade peptides, they don't guide you on dosaging. So, I even had one of my friends, he bought a bunch of research grade peptides, and it ended up being that each bottle that he bought of Samoralin was for one dose. And so he thought he was buying 10 vials, and it would last him several months, but he actually only bought 10 doses for like $300. And so like they can really, if you're not well versed in the peptide space, and even when you are, you can get some bad actors and get kind of tricked. And it's nice to have somebody managing your dosage, and that the price you're paying is for how many days, and you know when to cycle on and off, so it's good. Do you cycle on and off a lot of your peptides and DRT and stuff?
I mean, tier two year round. I don't think unless you're trying to have a kid, I really don't think you should cycle off because
Yeah.
life's that much better on it. So it's like, why would you ever come off? And there's no studies that show like lifelong usage of TRT is going to impair anything outside of kids. But even then, it's like hair loss. It's genetic. Like
Hmm.
if you have a really high DHT conversion, you're going to lose your hair or whatever. That's just you as a man, and it was going to happen eventually. Just speeds up that process.
Yeah.
Um, and some people can do both loads of steroids and still have kids, totally fine. And some can't. Some can like look at testosterone and be like, you're infertile for life now. So,
Yeah.
like I said, those are the risk you take when you like start going into this stuff. I don't think there's some stuff. I don't think like BPC. I kind of do it year round.
Hmm.
Because I'm in pain year round, so it helps a lot. I do the oral form. I don't do the injectable form. And then, like you said, I wouldn't suggest like oxytocin year round. I wouldn't suggest like certain cognitive things year round because I like to use those as tools versus like just leaning on them. So that's kind of how I gauge that. What about you?
Yeah, I cycle on and off my growth hormone. I do like 5 days on, 2 days off. Um, but I do agree. I think there's so much up and coming research that I think what people are saying to do is changing. And so I'm kind of just trying to go with the best protocol right now that I can find. But I think that stack, even I just ordered my intranasal oxytocin
Yeah.
because you inspired me. And so I think I'll do 5 days on, 2 days off of that, and just, a lot of it with peptides and all of these repurposed medications that we use is really symptom based. And so I often, you can't get lab work every single week. And so I track just overall how I'm feeling, because when you're really in tune with your body and you're working out and lifting and you're making that mind body connection, then you do notice even a 2% change when you wake up not feeling great, or even after a meal. I'm sure you personally can recognize, that was great for me or that was not great for me. And so different peptides and cycling regimens and supplements, they definitely will affect you either positively or negatively, and then you know how to adjust accordingly when you're kind of listening to your body.
Yeah, and a lot of times, so a lot of things that I take is like a preventative measure. Like the reason I take metformin is because I take growth hormone, and I love insulin sensitivity. That's like the one thing for death. Like if you have good insulin sensitivity, you're going to live a while. The second that starts going
Hmm.
downhill, your lifespan's just not as good. It's just a fact. Um, so it's almost like a preventative measure. And if I can take it and not lose strength, unlike some of the population, I'll take it all day. Now, so like for you, what are other tools people can take for like killer insulin sensitivity outside of metformin?
Well, my biggest thing with my clients, and the reason that I do like the growth hormone is because when you have just inherently more muscle mass on your body, that helps with your, glucose uptake because your muscles use glucose. And then I do other strategies with my clients. Like I will, with the nurse practitioners, we prescribe the glucometers for people. And so you can actually see what dietary and lifestyle changes personally help with your insulin sensitivity. Like, you might find that you eat something and then you go for a walk after, and you don't need to take anything other than just, doing a 5-minute walk. You don't need to take any meds or peptides. And then for my clients that are a little bit more into like the pre-diabetic route, we often do semaglutide or tirzepatide,
Mhm.
which is a GLP-1. And those are incredible. I mean, I microdose semaglutide just to mitigate my inflammatory levels. And so, a lot of my clients find that they just like doing those for a long period of time, and that helps with their, insulin sensitivity and regulation,
Yeah.
blood sugar, appetite. I mean, they've even shown in certain studies that it helps with like your actual like addictive food patterns, and your addictive behaviors. So even drug addicts or people that are recovering alcoholics, it'll actually help, um, at a brain level. And the providers at No Limits, they say very low dose GLP-1 is a much better option than metformin. I know you and I were talking
Yeah.
about that yesterday. Um,
Well, yeah,
I know
and
you have your reasons for being on metformin. I think your concern was the appetite
yeah,
control
yeah,
aspect, but I do think from an appetite standpoint, when I low dose the semaglutide, I do not feel like it suppresses my appetite. I feel like my joints just have a little bit less pain because of the, anti-inflammatory effect, but I think it would be, you know, interesting for you to trial both and see what you think.
yeah. So like, and like, what is it? Also, I just want to point out what Dima said, guys. If you like take a, let's say, a 5 to 10 minute walk after you eat, a lot of your health issues can get fixed. Like, it's not
Hmm.
fucking hard. Just go on a fucking walk. That's huge. I wish everyone would learn that. Just like eat some food, go on a walk. Uh, but for what you're saying, I think for me, something that I learned, I was watching a dark, like, fucking shit, had an aneurysm there. A Dr. Mike Intertel video. And he was going on about, he was like, all right, why are people fat? Like, what the fuck's going on? And it's not because your metabolism is that much different.
Hmm.
Metabolism is really based on how much you weigh. A 300-pound person of muscle or a 300 person of fat is going to have a pretty similar BMI index, just maintaining that weight. Now, energy consumption might be used, but it's different. Uh, so I was like, okay, what's the varying factor? I mean, activity level, that's huge. And then another varying factor is what's your desire for food?
Hmm.
Because some people just have a much higher desire for food. Um, I'm not one of those people. I don't really give a shit to eat. I could go I can eat some in the morning and then eat some at dinner and like I'd be fine. That could be like small things of like I can have a sandwich and a sandwich would be good. Some people, I don't know how they can fucking snack and eat and do everything all day and just get 6,000 to 7,000 calories in. I remember when I was trying to bulk and like really push calories of like 45 to 5 a day, I wanted to throw up every meal. And I was like, oh my God, I don't do this anymore. So for me, that's the only reason why I'm like, GLP-1s terrify me because I already don't eat. Like two
Yeah,
days ago, I went the entire day without eating and didn't even notice it. So I need to be hungry. I thought about taking the
yeah,
reverse of that and like a DHRP6 or ipamorelin, so I'd be more hungry. Um,
you should. The Macy Moreland that's an oral growth hormone peptide, the one that I'm taking, and it definitely does stimulate your hunger because it's one of those ones that pulses. It's like the short-acting growth
Hmm.
hormone peptides, and so it definitely has a little bit more effects on hunger. And I like, you do like you and I both do like 80 million shots a week, and so, you know, having that one be an oral peptide just in a pill form is really nice and pretty mindless. You just take it in the morning or before a workout or whatever, and it's very easy. So that's one of my favorites for sure.
I mean, I'll take oral stuff all day. I will do as much as I can, um, because, like I said, I'm tired of needles. There's plenty of them throughout the day. If I can do orals, I'll do it. No, I definitely give Mason Moreland a try for an oral, like hunger
Yeah.
stimulating thing. So I could probably take that in the morning before my. Now, is that one with some Moreland? When I was doing it intensely, I was doing like 3 to 4 shots a day. Same thing with GHRP6. Like I'd take
Mhm.
it every time before I had a meal at a super low dose. Do you take it multiple times a day? Is it a 1 day thing, or how do you take it, Mason?
So since I'm doing both, the Macy and Samoralin combo kind of mimics the CJC Ipamorelin a little bit, which isn't, FDA approved now, so it's harder to get. And so I'm doing it just once a day. But typically, if you're just doing the Samoralin, they do tell you to do it twice a
Hmm.
day, like in the morning and then at night, or even you can play around with it being like in conjunction with a workout and then at night because it does help with your sleep as well. And so taking it right before bed is great. I like to do all my peptides and then go lay down.
Yeah.
That's just my preference. Because, and I was on the melanotan for a while, which I had to do at night because it does make you super flushed,
Yes.
especially when you first start doing it, which for those of you who don't know what melanotan is, it's literally a peptide that makes you tanner, but without being in the sun. And it's super safe and it's great. And I mean, who doesn't want to be tan? Um, yeah. And so it would make me very flushed. And so I would just do my Samoralin, my melanotan, and then just go to bed. So then you don't even feel any effects from it. Have you done melanotan?
Yeah, I keep meaning to. I just haven't really worried about my tan that much. I probably should because when I go on vacation, I burn like a lobster. And that's one thing from Lantan. It can stop you from burning like a lobster.
Hmm.
So that's something I definitely need to get onto. So I know what. So back on the metformin and GLP-1 debate, I know with like one of the reasons I took metformin or I do take it is for cholesterol support. I was hearing that the only reason it's helping cholesterol is because it's affecting the insulin sensitivity. Like basically, insulin sensitivity is like the baseline of everything. Do you
Yeah.
know more about the science behind that and like what's the breakdown there?
Well, I'll let my providers comment back as well. But the discussion of cholesterol is incredibly nuanced because you can measure your LDL and your HDL, and even if they're elevated, you use cholesterol to make
Hmm.
your hormones and they're the building blocks of a lot of different things. So unless your actual triglyceride levels are elevated, meaning that you're
Yeah.
converting it and it's like in your bloodstream, and so you're converting it into like arterial plaque and everything, then that's when we would be worried. But taking just a statin just because your cholesterol is elevated or metformin and just treating based on like elevated cholesterol singularly isn't that important. And I think it's kind of more of a nuanced thing where you just need to look at your lab work and track your lab work. But all of my clients that I do coaching with that worry about their cholesterol, unless their triglycerides are really elevated and other cardiac markers are elevated, then I don't really worry about it.
Yeah.
Um,
Because you have like
because
the old way of thinking that's like, oh, LDL or HDL needs to be high as shit, LDL needs to be low as shit, cholesterol needs to be low, and triglycerides need to be low. And that's like the health standard.
Mhm.
And what I'm hearing more and more nowadays, like I said, the biggest marker I love seeing is my triglycerides went down. I mean, that's what happened when I took metformin. I was happy. I don't give a shit. I was like, life's good. I'm not dying. This is awesome. Um, but it's interesting to see how like traditional medicine is like statin, da da da, go back and forth, and now
Mhm.
we're going more towards like as long as triglycerides aren't fucked, you're kind of good.
Yeah, because I used to be a paramedic, and so you would run calls on these people that had cardiac history, and they were on the whole cycle of all these cardiac medications, blood thinners, statins, aspirin, all these things. But then you look at their lab work, and there was really no clinical indication for them to be on these, especially long term. And that's where we had a whole generation of people kind of tanking their hormones. Like one generation before us, where the low fat diets were really, really popular. And now we're like pushing the statins and everything is like we're really just tanking people's cholesterol, which are the building blocks for what they need for everything. And so if your cardiac markers are high and your triglycerides are high, then there would be other things to address such as inflammation. What is happening in your body that you're converting it. And we would worry more about that than actually just lowering your cholesterol. And you can take a baby aspirin every day and that's pretty benign and it's helpful for a lot of different things. And so that I would say like doing that and then not taking statins and just, working out and getting overall better cardiac health is way more important than like addressing it with all these little medications that have different side effects. And then you take another medication because this one is doing something, it's kind of a cascade where I think you and I are both on the preventative optimization route rather than like treatment of actual conditions once they get bad. So. But I think if you did the Macy GLP-1 combo, I think you would find that you would still be hungry, and I think you would be pretty happy with it.
Yeah, like I said, if I can keep hunger, also I just don't want to stab myself again. I'm like I'm already having to stab myself all the time. I'm running out of spaces. Um, yeah, I have to inject myself like minimum 3 times every day. On a day where I do more stuff, it's like 4 to 5, and I'm like, ugh. I'm like, can we
You're
please
like
stop?
you're like I'm tired of
I'm
this, Grandpa.
damn bad. It's like I got my like so we can talk about site injection stuff too because we both do it a lot. I do shoulders, quads, and glutes, and it's like one day's a shoulder, next day's a shoulder. I'd love to give it 48 hours in between times where I stab it, but sometimes it doesn't work like that. What other spots do you like pinning, or is that kind of your spot?
I'm really a stomach girly
Mm,
when it comes to my injections. I definitely have built up a little scar tissue. Um, but sometimes I do back of the arm. Sometimes I do like my hip fat for like a
mhm,
sub Q. I have these lidocaine wipes that I use from Amazon, and they have like menthol in them too. They're like alcohol swabs, but they numb the site. So you can actually rotate to fatty areas where you have a lot of nerve endings because you're numbing it better.
mhm,
And so I think just for the viewers, there is a difference between an intramuscular injection where you're actually trying to go into the muscle versus a subcutaneous, which is into the fat. And so a lot of the peptides are the subcutaneous. Same with the, testosterone and um, like the lipo shot and then carnitine, which we were talking about earlier. Those are actually in the muscle where you use like an inch and a half needle and there's very specific sites, but subcutaneous injections are a little bit more versatile where you can go anywhere that you have enough pinchable fat. And so the numbing wipe comes in clutch. Icing the site beforehand is amazing. But I do like the love handles too.
mhm.
But they have a lot of nerve endings. Like you really do have to numb that area.
Yeah. Well, that's why I stopped
And
doing my stomach is because my stomach just would pinch sometimes. And I'm like,
yeah. Yeah, I
yeah.
definitely have said some choice words mid and mid injection. Um
Oh,
yeah, so
so
my
no
per
limits. Yeah, they were just talking about IM versus sub Q. Guys,
yeah.
sub Q TRT. It's scientifically proven to be just as effective. Everyone, please go suck it. The amount of engagement I got in my video, I made a video about this. I had thousands of people comment like, "You don't know what you're fucking talking about," and I'm like, "Here, I will show you the clinical papers. Like, this is true." So, if you
Yeah.
want to touch on that more,
Yeah, absolutely. Yeah. So, what they're saying is, testosterone is not intramuscular. They always recommend sub-Q. And so, like a lot of my clients are on testosterone. I consult them, you use those little insulin syringes and needles, which the gauge and the length of the needle is almost like a eyelash. Like it's so tiny. And so if you go in and rotate sites, I do like back of the arms and stomach. It's really pretty easy. Our provider network, we ship everything to your house, so it's upon you to, do all of that. We help with the protocol and like how to inject and everything, but the needle is so tiny that it's really easy to do at home.
Mhm.
I mean, like you do several injections a day, um, and I do several injections a day, and as long as you rotate sites, you're fine.
Yeah.
So
No,
yeah.
and like fine. And people go back and forth on like absorption rate versus like absorption in muscle versus absorption in fatty tissue. And I'm like, it's not that different. Like, I'm
Yeah.
not sure. Do you know the science on like is it that much different IM versus sub-Q for everything? Like,
The
are there like water compounds
only
still better? Or,
the only thing you worry about is volume. Like if you were going to inject 3 mLs of something, so like a syringe this big,
yeah.
um, then you would want to do intramuscular. If you were to inject like zero point 0.1, which is a teeny tiny bit, certain sites can only hold so much liquid, but the amount of testosterone, especially that you're injecting every day, it's not much. And so sub-Q really is not different than I am. And so it's really just about the volume. Like you don't want to inject 3 cc's and like expand that fatty space and like the tissue. You'll definitely notice like a bubble and it'll be slower to absorb. I'm sure you've done that once or twice, or gotten an IM injection where they don't quite hit the muscle. And so, it's just about volume. That's it. But the testosterone absorption, IM and sub-Q really is not different. So sub-Q is definitely safer, easier to do at home and better. And yeah, they said side effects are much less if you inject sub-Q, which is definitely true. And being able to inject sub-Q is easier, and then you can do it daily, so you keep the level steady, which is also what you and I talked about the NAD. Because we offer that sub-Q, and then at Restore you can get IM shots of it, or you can get IV infusions of like 500 to 1,000. And I
Hmm.
do like the IVs of NAD or even NR, the precursor, but doing some type of NAD supplement or peptide or injection daily really helps keep your levels steady. So that's the goal with all peptides, or supplements, is taking them every day.
Yeah.
So,
And a lot of urologists, like actual clinical doctors, prescribe TRT on the most fuck ass regimens where it's like,
mhm.
hey, here's 100 milligrams every 2 weeks. And I'm like, physically, that makes zero sense. The ester of the testosterone is now out of your system. You're back to probably crashing. You're probably like 50 now because your
Mhm.
body's already shutting down because now you're putting exogenous testosterone in it. And that's where I have these debates with like clinical people all the time. So they're like, well, I'm a doctor and you're just a kid on the internet. And I'm like, you're also a dumbass.
Right.
Because that's wrong,
Yeah.
objectively wrong.
Yeah.
Have you seen a lot of things like that with people when you're talking like, oh, my urologist did this or something like that, and you're like, that is not right.
Yeah, it's really interesting how hormones even in nursing school or medical school, like they don't give a whole lot of formal training on hormones or appropriate management or even how they're processed or dosed. And so for me, my own personal journey with them was, you go to your OBGYN, you ask them about hormones, you get like a very baseline lab test done, but it kind of felt like they never really had the full answer on how to manage them. And so like the providers that I work with at No Limits, they do comprehensive hormone testing. They have, even up to a Dutch test, which is like your metabolism of hormones and very like nuanced hormone testing. And so you want that, but we see people come in all the time that they're on like a fifth of the dose that they should be on, or they're getting it topically when the absorption of the topical hormones are terrible, or even the pellets. I'm sure you've seen those, right? Where they actually take like a pellet and like implant it. And it just, it's really not, I mean, the pellet degrades after a few days or weeks. And so
Yeah.
you're like we were talking about with certain levels, you get a huge spike and then it kind of decreases. And so, we manage at appropriate dosing and then we track your lab work. And then, we also manage just based on symptoms. And so, really following up with the patient, and making sure that they're sleeping, that they're, have better energy is important too. So, yeah.
Yeah, that's a huge part of like there's so many things with providers who do TRT every day and like prescribe it and like work within it. If they're worth a damn, they know these things. It's just like common
Hmm.
knowledge. Like, oh yeah, of course you do daily injections. Like it's going to help with all this. When typically when someone's not that's how I can always tell how like knowledgeable someone is the second they start telling their dosing regimen, or when they start describing how they fix certain problems. And I'm like, okay, like there's even this huge thing now of like bloodletting for people on TRT where it's like, okay, my hematocrit's high, and I'm like, if you keep bloodletting, you're going to develop a disease because, first off, you're going to have a
That's
natural spike.
crazy.
You're going to have a natural spike, anyways, but it's going to baseline because you go back up and then you go back down.
Hmm.
Also, red blood cells aren't a risk factor; it's platelets. If your platelets are high, yeah,
Right.
that's not good, but it's not that issue. And that's a huge dude. So many guys are like, okay, blood again, and I'm like, you don't need to do that. Like,
That's
especially when you have
actually
psilocybin.
crazy. I'm
Yeah. Yeah.
more in the biohacking community, and I haven't dealt with a lot of that, but that's very interesting that
And that's
they,
well, that's what TRT clinics. TRT clinics say that all the time too, where they're like, "Oh, just go donate blood." And I'm like, when I work with them, I try to tell them like, "Guys, you don't need no. Like, please don't tell your clients to keep donating blood because it could cause anemia. Like, this can cause issues. Like,
yeah, I mean, you need your red blood cells for a lot.
well, also having extra red blood cells is kind of a performance enhancer because
Yeah,
that carries oxygen and that helps you perform better. I mean, people got in trouble in
right.
the Olympics for blood doping.
Hmm.
That's free blood doping. I don't know what you're getting pissed about. Like.
Right. Yeah,
with
and
limited side
also, I
effects.
mean, depending on the altitude that you live at, your production of red blood cells varies to compensate for that. So you're not going to go to a higher altitude, make more red blood cells, and then like die. Like, so that's yeah. And yeah, they're right. Red blood cells do not cause blood clots, platelets do, which is so true. And take your baby aspirin. Don't bloodlet.
Yep.
Um,
Hopefully, people
but
will get over that soon.
yeah, I think that's why it's so important to actually be managed by providers and have your tests followed as well and repeated quarterly because if you're not doing that and you don't have somebody that's actually guiding you through this that's very well educated, then you could really get lost in the sauce, the peptide sauce. So I think, it's kind of invaluable to have people in our services, you sign on, you get baseline lab work that is included in the sign up cost, which is great. And I started as a patient through No Limits. Now I do their, health coaching and I follow up with patients and manage them really closer. We have some patients with, you know, autoimmune issues and then their hormones are off and then they're, wanting to do all these adjunct therapies, but the world of biohacking and peptides can be a little salesy and hard to navigate at times. And so I just help kind of coordinate all of their repeat lab work, manage symptoms, write workouts, help them with nutrition, and manage their like inflammation. And so working with these providers who know so much about hormones and all the tests to do and what to take and appropriate dosing is really invaluable because our clients are getting much, much better just by properly managing their hormones. And then you can do all the fun stuff and peptides and all the nootropics on top of that, but just proper like baseline management is really invaluable. And we do have a lot of, drugs that we use that are repurposed drugs that we use to just enhance your mental clarity, like modafinil, which I'm sure you've thought about trying, probably. But you do the
So,
C-Max, right?
yeah, I do the Samax. I know someone asked earlier about my Samax dosing. I just do like one spray per nose. I think it's 100 microgram or 50 micrograms.
Mhm.
So it's like 100 micrograms. Um, I know guys who've done like six, 700, but they probably have much higher tolerance to stimulants than I do and are just more wired. I can't do that. I'll lose my shit. So personally, for me, also I always like starting with a smaller dose and kind of seeing how I feel. Like,
Mhm.
dude, if you take oxytocin and you megadose your first time, you're gonna be on your ass. It's like NAD. It's just like if you
Yeah.
took a grip and just full sent it the first time, you'd be like, I need a
Oh God.
break. It's
Yeah.
bad. It's bad. So that's the important part to like kind of gauge your dosing right, guys. Because if you don't, it's gonna suck. Bad.
Yeah. Yeah, and I think that's true. Like more isn't more. always, especially with the stimulants. Like modafinil is a stimulant, but it does enhance the function of some of your neurotransmitters. It's a very mild stimulant, but we always recommend our clients to take half a pill first and then see how you feel. Work your way up. We don't, the goal is not to give you a ton of whatever drug it is to make you do something really quickly. And, it's better to kind of lightly kind of increase rather than, like you said, with the oxytocin. I mean, it can make you feel a little strange if you do too high of a dose.
And then someone
But have you
asked
noticed
about the
like,
max. Okay, I will answer this the max
oh yeah, can you
quick.
touch a bit?
Yeah,
Yeah.
so Max, it drives up BNDF, which is brain-derived neurotrophic factor. It's amazing for CNS recovery. So, for somebody who goes through a lot of CNS fatigue from lifting heavy weights in the gym, stress, anxiety, it helps. Now, I would say if you're a really anxious person, Selenk might be your guy, but Samax works awesome with that. I use it nasally. Nasally has a shorter half-life, so the majority of it. It's very nervous system based and focus based, and it kind of that's about it. But this the CNS fatigue decrease that is such a huge win because you are so much stronger when you're not burnt out in your CNS.
hmm Yeah, and you're kind of getting a double whammy with the oxytocin as well, I feel like, which has a lot of like calming effects. So when you take these different brain enhancers, getting the oxytocin as well is it probably helps a lot. Do you feel like more focused when you take the Cimax?
Oh yeah, well, so I have ADHD. Would have thought? And it basically is just like ADHD makes me want to just do something else every 5 seconds. Like I have one tab open, I don't finish a task, I want to go somewhere else and not finish that task. When I take some Max, I can be like, all right, I'm gonna do this. I'm gonna finish this, and then we'll go on to the next thing. And it's that like it's almost like fumbling through something versus like being locked in and easily able to run through it.
hmm
So that's how I feel through it.
Yeah. Yeah, and with the modafinil, I also feel more focused. I feel like it does heighten my sense of awareness too. Like, it is a mild stimulant, but it's not like Vyvanse where you're like kind of like cracked out and hyper focused. It's a little bit more mild, so I just feel a heightened sense of awareness, a little bit better focus, and even better motivation because it helps with that like dopamine reward system. So like I feel a little bit more motivated and gratified by doing a task and completing it, like you said. But it's not about the completion of the task. It's like, you just feel better and more motivated to actually be doing something and staying on task, which is really nice.
And that's so another thing about testosterone. A lot of people associate testosterone with like anger and aggression and like alpha male shit. Testosterone's just the reward factor of doing things. Like you just have a really good payoff when taking it. There's no
Mhm.
word rage. It's not a thing. Testosterone just makes you more of who you are. Uh, so you
Yeah.
haven't done TRT, right? You're not on that.
Mm-mm. No.
I thought
I will
about it.
probably think about that after I maybe finish, like, if I want kids or not. Like, I have to kind of decide. Um, I
Now,
know
the,
we
the
kind of
studies that
touched
I've
on that.
done, it does not affect fertility for women. For the studies that I've seen,
hmm
like whatever I've talked to doesn't do it. I'm arguing with somebody. No, it doesn't. Sorry.
Yeah, and I feel like so for acne, I was on birth control for so long, which is one of the worst things ever. I was prescribed birth control when I was like 12, which affects methylation, your absorption of certain micronutrients. It's a huge regret that I have, but I was just very enveloped in the Western medicine system, and I didn't know any better, so I was on birth control for a really long time. So I think, helping my body with its own natural hormone production, and my hormones are completely well regulated and optimized, and just helping with my liver function. And um, I eat a ton of fat. Like every morning, like on the cholesterol subject, like I literally eat like a tablespoon of butter every morning. So like I eat a ton of fat. So that does help regulate and help you produce hormones
Mhm.
more efficiently. So everyone that's kind of scared of the fat and everything, I mean, fat is one of the best things that you can have. It's just the seed oils that are very pro-inflammatory and what you want to stay away from. but the butter, especially grass-fed butter, is great. And so that's one of my favorites. Um, I could probably just eat butter, but I think that would be a little overkill.
I mean, everyone, well, and that's a good thing too of like fats aren't bad inherently. I mean, I'm sure you can go on about how fats aren't bad. I do want to answer Bear's question real quick. Females take anywhere from like 2.5 to 5 to 10 to shit. Some taking 20 milligrams testosterone. That's about the range. I have never seen a girl on 100 milligrams. She would sound like me. Um, but every girl's different. Same with guys. Like some guys can be on 150 and be fine. Some guys can be on 250, 300 and be fine. It's very genetic
Yeah.
based,
And
but
that's
it's
why
a
it's
much bigger dose.
so important to get your labs done because they will dose based off of that. So, getting your lab work done and then dosing, and then also, you know, getting your lab work done again after you've been on that dosing protocol for a couple months, that really, really helps. And so that's one good thing about being with, a provider network like No Limits is that they will review all of your tests initially and dose based off of that to optimize your hormones, but then we'll retest and we'll do follow-up lab work. And so you're being very closely monitored by a provider, and you have access to them to ask questions or say, if you're on some progesterone, say like, hey, I'm feeling great, but I'm not still not sleeping. And they'll say, okay, take a little more, see how you feel. So you're kind of in direct communication with either me as your wellness coach or one of the NPs um, pretty consistently as you need to be. So
Mhm.
they said
And that's
typical dosing
yeah.
is 10 to 100 milligrams, depends on the person and the symptoms, but oral, not injectable.
I mean, I haven't. So okay, talk about oral TRT. Do you know much about that? Because I don't believe in it yet, but I also don't have experience with it yet. It's just new, and I'm kind of like, ooh.
Yeah, so it looks like No Limits, they asked, is oral better for females? And No Limits said yes. I don't have a ton of experience. So No Limits, their providers, they are really, really experienced with hormones. I have some experience with hormones and managing their symptoms, but my expertise is more in like autoimmunity, inflammation, peptides, and all the biohacking. And so they would probably be a good person to do a live with at some point because they truly are the experts. And that's why I love working with them because we're all good at something. And if one person doesn't know something, then we kind of piece it together. And so they're like, their hormone expertise is by far the best that I've ever seen.
Well, and there's always so much new data, and so the biggest thing I think everyone should realize here is that data is not the final statement because new data can come out. Oh
Hmm.
my God, who would have thought? And it's important to like see what's going on with all of your clientele, noticing patterns there, and be like, okay, well, data might say this, but the last 100 people I've talked to and have dealt with, this has been the case.
Hmm.
And I think that's what separates people who are, uh, you know, actively pursuing knowledge and pursuing things of that nature versus like doctors who just did school, they're a doctor and that's all they do. They kind of gave up on
Hmm.
learning. They're like, this is just what you do. Um, because that's where you get in the case where a lot of bad things happen
Hmm.
and you get in situations where you kind of fuck yourself because you listen to something someone said in a textbook 20 years ago.
Right. And that's the hard part. That's definitely why I got into coaching because even one of the roles that I serve is advocating for my clients because if you are not knowledgeable about these things and we don't expect you to be, it's a really hard, the Western medical system is incredibly hard to navigate, and so knowing how to even read a study or how to even advocate for yourself to providers can be incredibly difficult. And also to also like coordinate all of your care. You might have one doctor that's a cardiologist, and then you go to your PCP and they're all prescribing you different things, and they might even accidentally double down on something, or switch something that the other person had a reason for you being on. And so we bring everything back and do a more integrative approach and try to, I will take all my clients' meds and reconcile them. And then we'll, go through each of their providers, all of their lab tests, all of their supplements, and try to kind of bring it back to one strategic approach. Because I mean, I don't see how some people could even coordinate all of their care if they have 8 different specialists. And so that's where No Limits and I come in as we kind of try to hone down the approach. I mean, we have some people that we see come in on 2 different statin medications because one doctor prescribed them a statin,
Mhm.
and then the other one was like, yeah, you also need a statin, but they didn't communicate. And so you're double tanking, your cholesterol. And so just getting people's care a little bit more coordinated is pretty invaluable.
Well,
I'm sure
and
you
let's.
do that for yourself. You said you have a whole spreadsheet and systematic
Oh yeah, I
approach.
definitely press everything. Well, because I'm getting to the stage of my life where health insurance is kind of becoming a thing. I don't want to do it. I think it's a scam. I'm still figuring out what I want to do with it because I spend so much money on my preventative health, and if I want like bloods or something, I just go and get them drawn. And I ask. I have a
Mhm.
coach who like works with me. If I want to get an echocardiogram, I'll just go ask for one. Um, I don't know where do you stand on that? Because I'm like so torn on like if it's great like if I get my arm chopped off,
Mhm.
about it.
Yeah. I recommend, so what I personally do, and I'm not telling everyone to do this, but I don't have anything other than high risk insurance. So, like you said, if you were to get your arm chopped off, fine. But I work with No Limits. I started as their patient, and what they do is it's a subscription-based service where you can actually do urgent care visits with them, and it's all telehealth. And so I found that using like GoodRx and then them, the cost of everything is actually, I was paying hundreds of dollars a month for a quote unquote great insurance provider with my full-time job.
Mm.
And, I've had Blue Cross, I've had United, but it's like I'm actually paying less now and I'm in way better health because the providers, it's a subscription base and the peptides and everything are pretty cost effective, and I'm actually just in better health because I'm doing things preventatively rather than going in and treating every little thing when it becomes an issue. And so I haven't had any major health events. I haven't even been sick or had allergies um, in forever. And so yeah, I mean, I used to have chronic sinus infections. I have a connective tissue disorder, POTS, hormonal imbalances, and all that is currently being managed with different biohacking strategies, peptides, and preventative medicine. So for me, there's no need to have insurance. Like you said, you can order lab work online, which we do. You don't even have to be one of our patients. You can just order your own lab work through us, and then become one of our patients. And so it's more of a methodology where you take control of your health and prevent things rather than falling into the Western medicine system with insurance of being sick, getting treatment, getting surgery, and then being well, returning to baseline, which is not optimized, and you don't feel great. But everything's testing normal, right? Because the lab core values for everything are like the average person, which personally, I know you and I both don't want to be average. We want to be optimized. And so, yeah, working with providers that are a little bit more specific with their treatment plans and have more of an integrative approach is really important.
Yeah. So someone's asking what is TRT? We were just talking about TRT is very gauged on the fact of testosterone replacement therapy. It's replacing levels back to whatever person you're talking to something feeling better. But like you said, normal ranges for a man are 3 to 900. That's like the national standard. That's insane. You could the 900 would still be normal, and that's a 3x difference than the bottom range of that. Which, if you guys don't know, 3 times more testosterone in your body, you feel like a whole different bitch. Like
Hmm.
you are ready to like wake up, get day going, do work, feel better. I know when I started because I started my tier T journey with enclomiphene because I was like, I don't want to stab myself yet. I should have just stabbed myself. But I start with that, less side effects, less risk, but less reward. Um, and then afterward, I was like, okay, I got blood work done, and clomiphene was working, but I didn't know the long-standing use of like I want to run clomiphene my entire life because if you guys don't know this, the more you stimulate your pituitary gland, the more prolactin you can increase. It's just like a blood marker that kind of goes up with it. Prolactin can cause bitch tits. Girls don't care about that. I care about that. Um, I don't want bitch tits. So that's That's where I was like kind of going through it, and I was like, all right, I think I'm just gonna go to TRT, especially because I can like manage my estrogen on TRT from daily injections. So
Mhm.
let me just go this route. And when I was talking with the clinic that I work with now, it's just something we landed on. But man, just- when I tell people I'm like TRT's the shit, because going from a guy at like 400 ish is where I was kind of sitting at like 24 to like, you know, also it's 800 now, but my free testosterone's through the fucking roof. Which if you guys don't know, free testosterone actually does everything for you. Total testosterone's kind of just fun in the games or whatever. If your clinic
Mhm.
does not draw your free testosterone, they're stupid and you should fire them. Just saying that, by the way.
That's what I was gonna say is it's interesting too because when you work with the Western medicine insurance covered providers, when we have clients submit their lab work and they're like, yeah, I got a hormone panel or yeah, I got a thyroid panel, but what they draw is incredibly baseline, so it doesn't give you a full picture. I've actually not seen a client yet that's come in where we haven't had to get our own repeat lab work on them because it's just not comprehensive enough to properly treat somebody.
Mhm.
And so, that's a big issue too, is they're not getting the full picture just because they don't know, which is no fault of theirs because it's just how we were educated, um, which is a whole cascade of a medical system that we could, touch on, but I think it's so important to get, like you said, all those levels. Like you have to get a full comprehensive hormone and thyroid panel, which a lot of people don't even know about. And how can you even advocate for yourself if you don't know that that's an option? A lot of people don't. And so I think that's where, you know, your videos, especially on TikTok and Instagram, educating people are great. And that's definitely what I'm trying to do too. I
Mhm.
saw a lot of your videos on like the safety of stuff and making it seem a little bit. I mean, when you hear like TRT and gear and all this, it's definitely very there's definitely a scare factor to it that I think a lot of people have, and they think it is something that is very radicalized, which it's not. And so I know you probably, like you were saying, get a lot of comments on that.
It's a polarizing subject, especially because like people like I say what I take, and people are like, "Why don't you look like Mr. Olympia?" And I'm like, "Bro, I just started like 8 months ago. First off, second
You're
off,
like,
like
give me a minute.
I'm like, give me a minute. My dude, when I did my in body scans, I put on I think like 20 or 30 pounds of muscle in like 4 or 5 months,
My
like
God,
fuckload of
that's
muscle. Like
that is
no,
awesome.
it was crazy. And people don't see that. They don't see me back when I was like 190 pounds or something as a
Yeah,
runner versus like when I started TRT now, and like my body composition is different. My like every lift's gone up hundreds of pounds. Like
yeah.
there's a huge difference that's happened. It's just people don't see
Hmm.
all the things that go down. Also, I mean, I care more about telling other people like how not to die doing this shit because a lot of people just don't do it right. And I'm like, guys, just
Yeah.
let's just focus on the major part here. But girls all the time put Botox in their body. They put birth control. Like there's so many things that girls do that is
Hmm.
normalized, and I'm kind of like trying to bring it on to guys. Of like, all right, guys. I
Yeah.
also you all drink and smoke all the time. Guess what? You can do testosterone. It's more healthy for you, and you'll feel a lot
Right.
better. So that's
Absolutely.
kind of
Yeah. Yeah. It's interesting because, certain substances are normalized within our society, and then certain substances you kind of sound like a crazy person. Like when I lay out all my supplements at work, everyone's like, "Oh my God."
yeah.
Um, but I think
People.
it's just about whatever works for you. And so hopefully more people are starting to get into the peptide game. And I think it really does boil down to just having guidance on it, which you have your coach. And that's one of the things that I do. And your coach, you showed me his Instagram and everything. He's a
Oh
beast. And
yeah,
so
crazy.
you're getting good guidance. Um,
Well,
yeah,
and he's cool because he's
somebody
just like
said,
as nerdy as me about all this stuff. Which question they ask?
somebody said thoughts on DHEA. Um, so DHEA is really a precursor hormone for all of your other hormones. And so that's where just getting like a baseline set of labs, like we've been talking about, is important, because you can't really just take DHEA in and of itself and expect all of your other hormones to be regulated. Sometimes it's better to just supplement the hormones that you're lacking, and also the precursor to all those hormones. And so
Yeah.
it's very, very nuanced and it's very, very specific to each person. It depends on, I mean, even people metabolize, it boils down to even methylation, whether you are, genetically predisposed to not methylate as well, which is like a series of biochemical processes where you break down nutrients, make like neurotransmitters, make hormones, process hormones, detox your liver with glutathione. It's an incredibly complicated sciencey thing. We would have to put on our lab coats and talk about that one, but it's you might not be methylating well, you might not have the correct balance of hormones, which is important too, and so it's just dependent on the person,
Yeah.
really. And I'm
And
sure you agree.
no, absolutely. Well, and we were talking about earlier, so like, let me just go through labs you guys need to draw. Like, so first one's a CMP, a comprehensive metabolic panel. Second, your thyroid. Thyroid should include TSH, T3, T4, all three, not
Hmm.
just T4, not just TSH. What the fuck? And then we need
And
estradiol. What do you
yeah.
say?
And you can draw free T4, free T3, and then you can draw like TPO antibodies to see like if you do have some autoimmune condition that's affecting your levels of thyroid as well.
Yeah. And then for hormones, I typically expect like but this is also I always want to see PSA to see your prostate is 'cause if there's an issue there, we gotta fix it. Free testosterone, testosterone, estradiol for men. For women, do you guys draw prolactin typically too?
Um, we do, and we do like a full like, FSH, LH,
Yes, that's
you want to
yep,
see like
yep.
your ovulatory cycle, and all of that too, because we do
Mhm.
have a lot of clients that come in with, fertility driven like PCOS conditions. And so
Yes.
we do all of that. But we also have a Dutch test, which is like a very, very broken down test, to see like how you're metabolizing hormones. It does tell you your levels. But the Dutch test is the most comprehensive hormone test that you can get. And if you're truly struggling with hormones and fertility, men or women, then that's a great test. And then someone said, how do you know if you're methylating well? Um, so methylation is where you break down a series of micronutrients. There's a lot of genes that can be turned on and off that are involved. And so typically the way that you can tell, like just a preliminary lab test, we normally do a homocysteine test because that's one of the byproducts of methylation, where if you're not breaking down homocysteine and you have high levels in the blood, then you know that you are not methylating well. And then we would do a more comprehensive like gene test, where you can actually test for ours, I think has 8 of the most common genes to be affected. And so, and methylation, if you're not methylating, that affects your mental health, your hormones, like we were talking about, your energy levels, your immune system, how you're detoxing. So, like, if you're not methylating, that could be like the solution to everything. And that you can just supplement and focus on methylation and lower inflammation and, you know, get better. I read a whole book on methylation, and it's called like Dirty Genes.
Mm.
And there are even diets that you can follow and different supplements that you can take to help with your methylation. So, there's a ton of actionable things that you can do once you know that you're not methylating.
Yeah,
It's just about getting those tests.
and typically what people will do is there's like 4 or 5 genes that are like the big genes. You got COMT, MTR, MTRR, and MTFR. Um,
Mhm.
these are the guys. Like I got my methyl detox test back because I was trying to figure out what was going on me on the inside. I'm just curious. And as everyone knew, I mean, what do you think? What gene I have that's fucked up? If you just
Well,
look
I would
at where
guess
I'm talking. Oh,
COMT, right?
yeah, exactly.
Yeah.
Yeah.
That one specifically is a little bit more targeted towards the hormones. Um, and yeah, that's what I would guess. Did you have anything else that popped up on?
So I had COMT, and then I had the I didn't have an MTFR, but I had the MTRR.
Mm,
The I had the MTR and MTRR, if I'm right. So I think those two.
interesting.
Yeah.
And there are certain, I can send you it later, but there are certain diets that you can follow. And there's one provider that I follow his research pretty closely, and he has a checklist.
Mm.
So before you take a test, you can actually do like a series of like just paper, like checklist started tests where you get a score at the end and it tells you if you're likely to have these gene mutations. So you can track symptoms and manage it in a dietary way as well. And so, if you can't afford the test right now, there are still things that you can do. We definitely suggest the test as the top line thing, but some people just can't, afford that right now or whatever reason. And so, there's a way to manage symptoms even just with diet, because our typical standard American diet is terrible.
I mean, it takes years of. The only reason I eat how I eat now is I just did like I took a whole year where I just tracked everything I ate, made a big note. Feel good, don't feel good, and
Hmm.
every place I went to, I would monitor how I feel, and I just know like don't eat this game. You're not gonna like yourself afterward. Uh, if you got to do the testing though, or like you said, you can do that back and forth. But so many things that we feed ourselves with, just with how food is just not
Hmm.
good at all. You feel terrible afterward.
Yeah, I used to be a vegetarian actually. And that was
Right.
back when I was on birth control and everything. So my hormones were out of whack. I was exhausted and I felt terrible. And I was, 40, 50 pounds heavier than I am now. And that's not to say that I'm just not an advocate. Like, I'm a huge advocate for eating meat,
Mm.
especially if you can get high quality meat. But I'm, in accordance with people doing what they believe in. But for me personally, the vegetarian diet was terrible. And I
I
know
believe
probably with your
vegetarians
workouts,
are dumbasses, but that's just me. Um, there's
that's
no
the
science.
non-PG answer.
Yeah, I don't, man, I don't make PG content. I just get mad when people do things and they think it's right. And a lot of time it's not for moral standards because I'm like, you
Yeah,
drive a car. You obviously don't care that much about the fucking environment. Like, if you're really that woe is me vegan stuff, then don't do anything. Just don't be alive, actually. It's deadly for the environment.
that
But
is
that's me on
true.
my high horse. I was going to ask you, did you notice your attraction to men change when you got off birth control?
Yes.
Okay.
Yes.
Everyone asks that.
Yeah, absolutely. Yeah, I
How
think
so?
my attachment style and my mental health changed as well. Um, and my reaction to certain things. And so birth control is a lot more detrimental and impactful to certain things than people realize.
Mhm.
And that's not to say that if that's the only option for you, then fine. But if you can cycle track and, do all of the other things and not be on birth control, it's way better. I mean, my mental health changed. I was, on and off, I tried like some antidepressants, wasn't feeling great. And I just was
Oh,
never
my.
like happy.
But my sister
I was
here is
never
like,
happy.
I'm like,
Hi.
what in the, hi. I literally was like, I like walking around like, what the fuck, what are we talking? I thought he was on a work call.
yeah, talking about birth control.
Well, that's why I was so confused.
You're like, why is Cameron talking about birth control? I'm fucking work call,
We're
man.
talking about how bad it is.
Well, you just got off of it too.
Now he's got it again.
You
Surprise.
got it again?
Yeah, I'm bleeding. I don't know what the fuck.
Your birth? Wait, you got back on birth control.
Oh, no,
What's wrong?
period.
Birth control.
I'm talking about my period.
Very different. Well, Kate, what have you noticed since being off of it so far? Because you've recently gone through this journey, and you're in prep too for a bodybuilding show.
I am sorry, I just long day work. Um, Before when I was on birth control, I had cramps like someone was stabbing me 1,000 times in the back and the stomach, all over my body, just a lot of pain. Now I haven't had one cramp. I literally don't get. I just bleed, and then I'm really emotional.
Yeah.
Which before I wasn't like I wasn't emotional. Which not that like I wasn't, but like not. There wasn't like a time where I was like. I knew like, oh, I'm about to get my period. I'm on my period, and then when I'm off my period, I'm like, oh my god, I love life,
Hmm.
and the world's okay. Like I'm touching grass.
Yeah.
When I now when I like I'm on my period, will cry just like randomly, which isn't normal at all for me or wasn't normal. Like if I see something sad, like I'm just way more predisposed.
You're a woman. You should have feelings. It's a
What is
part.
mine?
That is
She's like, I
true
don't know, I'm
because
doing shit.
being on birth control, you don't realize how incredibly out of tune you become with your body. And so I feel like when you actually like know what's happening in your cycle with your hormones, even becoming emotional, you're like, "Oh, I'm about to get my period." So
Yeah,
you become more in tune with your cycle. Even when I like ovulate, you can tell like your skin is glowing, your mood's
yeah,
better. But when you're on birth control, you don't have any of that. So it's kind of just like this static
yeah. You're just
level
like the
of like,
same.
yeah,
That was the biggest thing
absolutely.
I felt was actually ovulating and being like everything is just amazing, and I have so much energy, and the world's
Yeah.
okay, and
You're like, this is
nothing's
great.
nothing's wrong. I'm like fucking dilly dallying in like a field. I don't know.
Yeah.
All
The
the fun
difference
stuff.
between ovulating and then your period, you're like, you look in the mirror when you're ovulating, you're like, oh, I'm actually not ugly. And then, when you're on your
No,
period, you're
literally.
like, oh my God.
Exactly.
Well, here I have to run to another podcast, but I think we should keep this up like a Tuesday standing thing because I mean this did great. Everyone's
Absolutely.
very interested, and we talked about a lot of good
Absolutely.
stuff.
Sounds good.
I appreciate you being on. I need give
Yeah.
me pricing for drugs because I want to get drugs
Okay.
from you guys, but I need pricing. So
What
Yes,
they
we will
should they
send
put that
everything to
pharmacy.
you.
for a pharmacy?
Yeah, so like farmer grade stuff.
Give me a
Kate might need to get guys up to.
Yeah. I'll friend her on Instagram and we can message back and forth if she has any questions.
Awesome. I appreciate it. Appreciate it, Courtney.
See ya.
See ya.
Bye.